Welcome everyone, and thank you for joining today's webinar, How Surgeons Get Paid Faster and Save Time. Today's presentation will be given by Drs. Lucian Newman and Drs. Brett Schillingstead.
Great. Thanks, Regina. My name is Lucian Newman. I'm a general surgeon practicing in Gadsden, Alabama, and I'm in a group practice, private practice, with my brother and my father and another partner. And so one of the issues that we encountered 15 to 20 years ago was all the ravages of trying to keep up with documentation rules. Dr. Schillingstead, you want to give your background?
Sure, and I'm also a general surgeon, practiced for many years, and also spent about 13 years at Epic, helping to develop tools for surgeons and proceduralists that were really lacking in the EMR. So I have a lot of experience with the struggles and the good and the bad with working in an EMR.
Next slide, Regina. So our agenda today is to discuss the current workflow issues with surgical documentation, and we'll focus heavily on a demo of what we offer. And so, you know, historically speaking, and I've been in practice for 28 years, I'm a chairman of Blue Cross Blue Shield of Alabama, and I've been on that board for 16 years and served in numerous capacities in my 2 hospitals. The problem is the way surgeons are being judged. And if you look at the current workflow, the status quo is documentation via transcription. Of course, voice-to-text solutions have been widely applied across our industry and do help in some regard, but it still remains to be seen that if you use dictation or voice-to-text, you don't have a process in place. And so to be able to use the CPT book appropriately and the ICD manual, a rules engine, in my opinion, needs to be in place, and that's what we offer. So evaluating this workflow, there's traditionally a dictation and then transcription that's reviewed and sent over to coding and billing. It may be complete, may be incomplete. There's just a lot of different gaps here that lead to delays in accounts receivable. It's hard to track down busy surgeons. Busy surgeons don't want to talk to coding people necessarily. And so this tool that we're going to show you kind of bridges the gap between the surgeon with the information that you have to have moving forward. Next. So the CAPD workflow, using this tool within your parent software, whether that be Epic or Cerner or Meditech or any software that you have, this software works inside of those tools to produce a rules engine-based note. And so we talk about and hear about artificial intelligence and machine learning. The reality is that those tools working within this are trying to make it the workflow for the surgeon much easier. And so the benefits you see on the right there, you get complete and accurate documentation. There's no more immediate post-procedure note that's scribbled and incomplete. We don't have transcription edits. The goal here is to eliminate queries, and across our network, we see about a 1% or less query rate. And so this is an automatic pro-fee note complete with a charge capture. And so these records are available immediately in your facility, in your office. They can be reviewed anywhere since it's software as a service. And so the referring physicians get the note often before the patient's in the recovery room. And so the impact includes decreased AR, accurate reimbursement, and reduction in cost. And so during the demo, and once again, I think seeing the tool in action is much more appropriate, but this is the general view that you'll get. And basically, it's meant to be simpler looking and almost software for dummies. You know, when you look at some of the software tools that we use, there's just too many places where you're not exactly sure, you know, where you should click. So, Brett, you want to add anything to that?
Absolutely. Yeah, and one of the things that I think an EMR does well is does a brief op note, but where the EMR tools really struggle is doing the operative summary and the actual procedure that was performed. So that's a second step you have to actually do if you're using an Epic, Cerner, or a Meditech. The other risk that you run into is many times the nurse will put in the surgical log what the procedure performed was, And if that doesn't get edited when that surgical log is closed in the EMR, you may not get paid for the procedure you performed. So by using this tool for the operative procedure, we actually take a look at the procedure performed. It suggests what the appropriate CPT code is, which in many cases can be a more complex procedure, which will then notify the coder that based on the operative summary that this is a more complex procedure, and it makes sure that you get coded and credited for the procedure you're actually performing. So really goes beyond those big bulky templates you use in, say, an Epic, Cerner, or Meditech. This will actually work for multi-panel procedures, whereas that's a big sticking point, certainly with EMR tools. So I think you're going to get the idea of this, but, you know, I think for increasing revenue, fast, easy, and being able to be used in complex cases, there's lots of benefits to this tool.
So I'll also add, this tool is used in over 60 different medical specialties, including literally anything that's in the CPT book. And so one of the comments that I generally like to make is that the surgeons typically know the answer to the question, but they don't necessarily know the question. And when you look at common procedures, whether it be hysterectomies or thyroidectomy, I think there's 11 different thyroidectomy codes, and the words that you use to describe it very often are the same things you've been saying for many years, and you may not realize that there's something else that's stated just a little differently. And when we use voice-to-text and transcription, sometimes our own words trap us into a detail that it doesn't properly describe what you did. And so being able to see the list of potentials while you're using this tool at the point of care, it's much, much more accurate. And so I typically use this in the physical operating room itself. It has lots of other functions, including analytics and, you know, safety measures and comorbidities. But I think we're just going to turn it over to Ryan Dorminey, who's a product specialist, and he's going to walk us through some demos, and Dr. Schillingstadt and I will chime in during the demos to give other explanations. Ryan?
Thanks, Dr. Newman. Can everybody hear me okay and see my screen?
Yeah.
Perfect. Again, thanks, Dr. Newman. Thanks, Dr. Schillingstadt. So just a little background on myself. I've worked with the surgical CAPD application for about 8 years now. I've been working directly with surgeons to develop this application. So we like to refer to it as software designed by surgeons for surgeons. So just to note, you know, typically the workflow is the physician, you know, they walk out of surgery, they're taking off their gloves, they go to the dictaphone, or they go sit down at the PC to use a front-end speech tool. So the idea is that we're replacing that post-operative workflow with a guided workflow within this application. So one thing to note, it is cloud-based, so it can be done on a desktop, a tablet, or a cell phone. So the first section you'll see here is the launch pad. So this has the daily schedule. So, you know, as the physicians are doing surgery, you can see their schedule is populated here. So this first patient, we'll just say we did surgery on patient John Wayne. So all the physician has to do at this point is select begin report. So once that loads, the physician is going to be taken into the surgical workflow. So you'll notice on the left-hand side it has a navigation, and on the right-hand side it's really where you're building out your note. So typically, you know, the physicians will go in here and they'll build out their typical notes they're creating. So as a general surgeon, I'll go ahead and select a laparoscopic cholecystectomy, and then I'm going to, you know, go through and fulfill that note. So one thing you'll note is we have yellow triangles, red triangles, and green checks. Those are basically just visual indicators of, hey, doctor, we need a little more information, there's a hard stop, or you're good to go. So really at this point, we'll just work top to bottom. So preoperative diagnosis, we have gallstones added with a yellow triangle. So at that point, it's basically asking for a little more information. So we'll say it's with or without obstruction. So at this point, we got a green check, and it's calculus of gallbladder with obstruction, and so we'll move on. So postoperative diagnosis, typically your post-op is the same as your pre-op, so we'll go ahead and pull that over. Again, there are things like diagrams and images you can utilize in the application for those visual pieces. So we'll go in here and we'll say that, the gallstones were located in the gallbladder. And then also if we want to add an image, you can also add, images like fluoroscopy or actual images of wounds, things like that. So our procedure performed, a laparoscopic cholecystectomy. This one doesn't have any additional questions. So really at this point, the physician just has a few more fields to fill out. So the estimated blood loss, we'll say it was less than 25 mils. And then our findings, we'll say were gallstones. And just one thing to note, these fields will start remembering your behavior as you use the application. So you're not having to, free-form type things or free-form enter things each time. It's starting to remember things you do on previous cases. And then another note is we do have this Dragon application built into this workflow. So in any of these fields, you can use front-end speech to talk into it. So really the last two sections we have here are our indications and technique. So indications, we can pull variables such as the patient name, age, male or female. You can also save different descriptions here in this drop-down. Again, you can supplement this with text, and you can also supplement this with front-end speech. And then the last section here is the technique. So this really describes how I did the procedure. So patient was placed in supine position, we made an incision, the gallbladder was grasped, the abdomen was inflated, and then the patient tolerated the procedure well. Again,
I'd like to point out there that one of the other differences, and I think Ryan's showing it to you there, you can load multiple different versions of the same procedure, and the goal here is to, once again, respect the surgeon's time and add personal context. This is not, a one-size-fits-all note, and we have a library sitting at the bottom, so if you come across a procedure that you've never done before, you can click library and it'll show you, a gallbladder probably has 400 or 500 different versions, but chances are the surgeon uses a technique that's similar, but they may change 5 or 6 words and click Save New, and then it becomes the next version, their own personal version.
Yep, and for example, here you can see we have this chronic one at the root cut biopsy, one with adhesions, acute, minor bleeding, etc. So those are just a few different examples of how I can go in there and customize those descriptions and quickly pull those into my note. So really at this point, the physician's done with their note. We've got everything specified, the note's complete, we have an image on there, so we'll go ahead and save it. So at this point, the physician's going to e-sign the note. Once they do that, it's going to go back into your parent EHR, so it'll be available for any other clinicians who need to view the note. We'll also generate this note for your office. So as soon as you complete the case, this will go back to your office as a PDF, and then we also will generate the suggested charge report. So based on the way you answer the questions within the report, we'll generate these CPT and ICD-10 diagnosis codes for your office to go ahead and begin that professional billing. So I'm going to jump in and just show, I'm going to show a few different examples. So that was a pretty basic procedure, laparoscopic cholecystectomy. I'm going to jump in and show you another one that's common among general surgeons and other surgical specialties, maybe orthopedics and others. So again, John Smithy is our next patient. We just walked out of surgery. We just took off our gloves. And instead of going in and you're picking up the dictaphone and just doing a free-form dictation, we're going to go in, select our procedure here. So we'll say we did an excisional debridement on the foot this time. So at that point, we'll go ahead and apply our custom report. And then really, we're just going to answer the questions. So again, working top to bottom here, we've got a yellow triangle on the preoperative diagnosis. So we'll go ahead and select that and move on. So it's got one question here, what side was it on? So we'll say it was on the right side. So postoperative diagnosis, again, we can pull that over. If you want to add another one, you can here as well. Procedure performed. So the excisional debridement does have quite a few questions. So just to show you here, the location was on the right side. The foot was where the wound was. So the depth was into muscle. The total square centimeters was, we'll say 29. Type of tissue removed was devitalized. Instrumentation used was a curette. And then we have pre-wound was a 10 by 5 and post was a 10 by 9. And then our dressing here. So it feels like there was, a lot of questions, but the thing about this application is as you're using it, we're answering things that are going to be queries later on. So if you don't give the, the coding and the billing folks downstream the information they need, they're going to come back and say, hey, physician, where was that? What was, what was the depth of that wound? What was the location? What was the total square centimeters? So by using this application, we're putting all that information in front of you in one pass. Go ahead, Dr. Newman.
It's an excellent example of the surgeons know the answer to the question, they don't know the question. And excisional debridement happens to be one of the most heavily RAC audited procedures in the United States, namely because lots of different types of surgeons do it, and they have different cadence and habit for dictation. So if you provide them with an appropriate set of questions that they answer, then it makes it much, much easier to comply with the rules and to get paid.
Yep. So just kind of moving on here. So we have our assistance filled out, our blood loss, our findings. So really, again, we're going to go down to our last two sections, our indications and our technique. So John Smith, 31-year-old male, presents with a cutaneous abscess. Again, if I want to supplement this, I can simply type in this box, or I can use front-end speech to talk into Dragon. The last section here is the technique. One thing to notice is that within the technique, we'll pull in these blue variables. So the way you answer those questions under the procedure section earlier, it'll actually start filling out your note and make this a little more personalized. So it's got the side, it's got the location, it's got the measurement, the devices used, and et cetera. So then also one thing to note is we have the images down at the bottom. So you can go in here, you can put a ruler up beside a wound so you can actually prove the size of that wound so you don't have any denials or anything that comes back after the case. So again, at this point, the physician will go ahead and save the note. They're going to e-sign it. And again, that's going to go back in your electronic health record. This report will be available to your office, any referring physician's offices, and then also the suggested charge report will be available for your office as well.
So as Ryan's keying up another case, everybody asks how do the images get there? And so this is software as a service. We obviously have a mobile app. You can take it with an iPad. You can take it with your phone. It does not go on your phone. It goes into the cloud and onto this report. And so that's the way that we can import photographs of wounds and CT scans and fluoro and ultrasound and cancer staging reports. I mean, the number of ways that people use that tool is immense.
Yeah, and one of the other things I would add is not only does that CPT code go to the physician's office, but it also goes to the revenue people at the hospital. So if you do work for a hospital, they're going to get those codes as well. If they don't match, it will go into a work queue for the coders. If it matches, there can be a charge router rule that can just auto-drop those charges immediately. It doesn't stop anywhere if those CPT codes match the surgical log.
Yep. Thank you guys for the input. So I'm going to show one more example here. I'm logged in as an orthopedic surgeon just to show a little bit of variation. So again, I've logged in here. I've just come out of surgery. So I've pulled in my total hip report. So preoperative diagnosis, I've got osteoarthritis of the hip on the right side. So I've got a green check, so I'll move on to postoperative diagnosis. So that's typically, again, typically the same as the pre-op, so we'll go ahead and pull that over. And then under our procedure performed, we have a yellow triangle. So we'll go ahead and select that and then specify the graft utilized, as that's the one that has a yellow triangle. So it's with allograft, autograft, or without graft. I'll just say it was without a graft this time, and then we can move on. So another item here you can do is you can pull in the images again. So say you have a fluoroscopy image of the pre and the post hip, you can add those, and then we'll just move on. So the last few sections we have are the blood loss. So for this case, we'll say there was 50 cc's of blood loss. And then findings, we'll say there was bone-on-bone hip. And again, you can dictate into this with the Dragon system. And then the last few sections here, we're just going to finalize this note. So the indications here, we have Ryan Berry with a 61-year-old male presenting with osteoarthritis of the hip. Again, if I want to edit this note to supplement or add any additional information, I can. The technique section, so this will describe the different, variations of the procedure. And again, just to show you, within the technique section here, so say I have an SROM implant, a Karai stem implant, or, different variations of the way I do my total hip, we can pull that in. One other thing I wanted to show was some the variables. So this is something that physicians, like to use in our system. So a lot of times on a total hip, it's going to have some variation in the actual devices that are used. So we'll say we used a Stryker Triathlon. So then it's going to ask the cup size. We'll say it was a 43. The screw was a 15. The second screw was a 20. the liner was a 28, the femoral component was 2, and then the femoral head was 22, and the hip neck length was a 0. So at this point, just going to exit off of that and kind of show you here. So you can see as I was answering those questions, it's answering all these different variations in the description. So for these types of procedures that do have a lot of variation in the implants, we can put in the variables there to create that note, make it, really more personalized. So at this point, we'll go ahead and say, we've got our images on the note, we've got all of our information specified. So again, we'll go ahead and save the note. So we'll e-sign it. And again, once I e-sign it, it's going to go back into the EHR. It's going to be available from my office, any referring physicians, and then also the suggested charge report will generate the CPT codes and the ICD-10 codes. So as soon as I finish the note, my office can go ahead and start billing and coding for this case.
So one of the other comments, go ahead, Brett.
I was going to say, I'm going to stop there, and I'm going to let, Dr. Schillingstad and Dr. Newman, if you guys want to comment on anything else or
yeah, so one of the things you're looking at there is the candidate inpatient procedure, and that comes from the Medicare inpatient-only guidelines, and so it's entirely possible to schedule a case that is outpatient possible and actually change it during the operation. I had that experience with scheduling an embolectomy that turned into a thromboendarterectomy that actually breached over into the inpatient-only. So if that patient's sent home, it becomes a problem. And so every case that you log in and commit to a CPT code will be able to display the inpatient-only procedure note. Another couple of comments, if you fill out one of the fields in this report, it's also available for analytics. And so you literally can go calculate, how many any different procedure with what combination of diagnoses, and look at a lot of different variables, so to speak, with the report. Another thing, the American College of Surgeons report that's required for case log and recertification is automatically generated. That's a major pain point for a lot of surgeons who don't have this, and Ryan's showing you how that works. And so you literally can pull it up, put a date range in, and have that note immediately. And so, I like to tell folks that parent EMRs are suitcases where you put your stuff, and this is a dry cleaner that's focused on capturing information related to the procedure. And so we've tried to make this as easy as possible to collect much better, more complete information. And the reason's kind of simple. We're in a very an environment that's changing and is very analytic. And so for surgeons to keep up with the rules, such as ICD-10 or ICD-11 that's slated for January next year, I believe, you don't have to know anything. You just answer the questions that you've been answering. And so, the mobile app is what he's showing you. Obviously, it's free download. I use it every day. I mean, it's great. And when you're on call, you can go look. If you have your partner's patient that's calling you, you can dive in there very, very quickly. Much, much faster than going through the parent EMR and looking for an op note that was done, 1 week, 1 month, 1 year ago. And so, Dr. Schillingstad, you're more expert on using Epic and the parent EMRs. I'd like to hear what you have to say about all that.
Absolutely. And one of the things that always scares me is you see a case get scheduled like a surveillance colonoscopy. Everyone's busy. Doctors are flustered with the EMR, and many times don't have time to double-check CPT codes or edit the surgical log, and the nurse will close the log, it'll say colonoscopy, and even though you dictate colonoscopy with polypectomy or other procedures, you never get credit for that. And you just hate to see people not paid for the work that they do. And there is a substantial subset of cases that are undercoded and you're not realizing the revenue that you're due. And I think by having a very good tool to do the operative procedure, this is a great adjunct to what you're doing. And it also does far, far better than the blob of text with the templates that Epic gives you for the description of the operative procedure. Certainly, we're auto-populating the parts we can that would be in the brief op note, but it doesn't fix the problem of what you do with the full operative note. The other thing, too, is if you do your full operative note with this tool, you don't even have to worry about the brief op note, so it's one note instead of two.
All right, I think Ryan's going to pull up secondary diagnoses. You know, one of the other things is, as the surgeons very often are the only ones who can actually answer the primary diagnosis, although almost everybody, you know, has the other diagnoses that could impact the DRG. The other thing is that surgeons who believe that those things don't impact them, unfortunately that's not true, because if you do enough cases without secondary diagnoses, it looks like that everybody on whom you operate is healthy, and we know that's not true. And so I realize that not every surgeon is going to be comfortable answering questions about congestive heart failure or diabetes, but we give a very, very easy way to search and answer the questions. Very often I consult with my anesthesiologist. I have this tool running in the room where I'm operating as well as in the dictation lounge. And so we actually can display this on the wall as we're operating, which enables the entire care team. I think Dr. putting a diagnosis in, I'll share that sometimes the circulating nurses may just say bowel surgery. It doesn't specify small bowel or colon or which part of the colon. And so often the records that we have do not have specificity. And that's an unfortunate mistake. And so the surgeon obviously can answer those questions appropriately, and giving them a tool to make it easy is very important. The other thing Ryan was showing you was what we kind of euphemistically call the onion skin. You can make a note very, very simple and fast, like a cataract or a pain procedure, but you can also expand the boxes. You don't have to ask for, you know, the technicians to expand it, but you can see we work in university programs that are very large that want to include more items, including fellows and residents and so forth, but we also work in surgery centers that, you know, just want to get done quickly. So this is an optimal tool for anybody doing research because of the analytic capabilities. We build special report types such as cancer surgery. We've built special work types such as a pre-op hernia work form and a post-op hernia work form for surgeons that are specialists in hernia repairs that want to do research. And so, once again, this is meant to be the optimum capture tool for the event that's happening in your hospital. So if it's time for questions, Regina or Greg, if y'all want to chime in and let us know how to do that.
Thank you very much.
Yeah, we have a Q&A feature in the bottom right-hand corner, so if you have any questions, please enter them there. And we are at the bottom of the hour, so we've gone a little past time. We appreciate everyone attending today. We'd like to thank you for joining us, and you will be receiving a recording of this webinar within the next week. If you have any questions, let's see, can you
and I can see one question there. It's asking if it's available for gastroenterology procedures, and of course the answer would be yes. Some of the other areas that we've used this for is cardiology, so it isn't just a traditional surgical tool. It can be used for other proceduralist areas as well.
Yeah, and I would comment that we have diagramming that Ryan touched on, but for procedures such as cardiology, we get a vascular tree of the heart to actually be able to show where a blockage might have been or where a stent might be placed. And so there's a lot of different flexibility with this tool. And once again, you can use it for ophthalmology, or you can use it for cardiac transplant or endovascular neurosurgery. It really doesn't have boundaries, which makes it very utilitarian for small and large hospitals alike.
Okay. Do we have any other questions?
Ladies and gentlemen, if you'd like to ask a question over the phone lines, please press 1 then 0 on your telephone keypad. You may withdraw the question at any time by pressing 1 then 0 again. If you're using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question over the phone lines, please press 1 then 0.
Okay. We have another question in here. Do all the images come over directly from the EHR through an interface? Are they always available in Nuance?
Yeah, you know, we can pass those images from the EMR, so, you know, certainly Stryker and other images are available, and they can be attached to any note or document that's brought into Epic, including this one. Or you could use the Vincari tool to attach it, and if it's attached there, it'll, of course, show up in the report that's saved in Epic or Cerner or whatever the EMR is as well.
Yeah, and they are always available attached to the note and the event. These can be inserted back into the PACS system, but to be able to review the images that happened with an event, we feel that it's appropriate for them to travel with the actual event. So Regina, if there aren't any other questions, once again, thank you for joining today. We'd be happy to field any questions related to this, and just let us know how we can help.
Okay. Great. Well, thank you very much. And if you have...
Yeah.
One of the questions that I did see was if the surgeon could indicate a complication, if it was inherent to the procedure or not. If we've got just a minute, I can show you where we can document that.
Yeah, go ahead and key that up. And so that's an important addition. The language that we use describing a complication is very important for a complete coding. And so if a surgeon uses the complication box, then we will, as Ryan's showing there, we'll show the wording that is necessary to further delineate what the complication is. So, and he's just walking through, you know, the questions that come in front of the doctor. You know, usually that's a after the fact occurrence that they're wanting to know, was it inherent to the procedure? And so in that manner, it's very easy to document the complication. Obviously, a lot of surgeons are reticent to include that, fearing, you know, retribution, but in fact, in my opinion, the best time to discuss that is doing your documentation.
Yep, so that was something I wanted to point out. And then also I saw a question about the relationship between Dragon Medical and this surgical CAPD application. So Dragon Medical, as you can see, is this little floating bar on the window. So it is built into this application. It is actually embedded within this application. So simply by just clicking the Power Mic button or clicking the record button here on the screen, you can just talk into it and it'll actually type it out on the screen. And then there's also some navigation where you can say next field, previous field, etc., and it will actually navigate the screen. So I just wanted to kind of point that out, that this is an embedded speech app within the surgical workflow. So the physician, again, they don't have to go log into a separate Dragon system. As soon as they log into here, Dragon is available within this user interface.
Okay, and I'm not sure if we answered this question or not. Does it prompt a note to answer any questions based on a dural tear or other events?
So if the dural tear is a complication and they list that, they would list that as a complication and the same set of questions would appear. And so obviously it's not going to if you repair the dura, it's not going to automatically add that. I guess that's the gist of the question.
Okay. I think that's all the questions that we have in the queue. Are there any questions on the line?
We have no questions over the phone lines at this time.
Okay, great. Well, if there are no more questions, and that concludes today's webinar. We want to thank everyone for joining us today, and you'll receive a copy of this recording within the next week. If you have any questions, please feel free to contact me. My name is Regina Hall at regina.hall@nuance.com. Or if you'd like to request more information or a demonstration for your facility of Nuance Surgical CAPD, please contact us via the website at nuance.com. You can go to nuance.com/go/CAPD, or you can call us at 1-877-805-5902. And contact information is up on your screen. We thank you for joining us today, and we hope you have a great afternoon. This concludes our webinar.
Ladies and gentlemen, that does conclude our conference for today. Thank you for your participation and for using AT&T Conference Service. You may now disconnect.